Hi guys, welcome to our channel. Today we discuss about hypermetropia. First we discuss about definition. Hypermetropia is an error of refraction in which parallel rays of light from behind the retina, when accommodation is at rest. Second we discuss about types of hypermetropia. Type 1 axial hypermetropia. Type 2 curvature hypermetropia. Type 3 index hypermetropia. Axial hypermetropia. When the anterior or posterior length of the eyeball is shorter than normal. A decrease of 1 mm in axial length produces a hypermetropia of 3.0 d. Curvature hypermetropia. When the curvature of the cornea or a lens is flatter than normal, an increase of 1 mm in its radius of curvature produces a hypermetropia of 6.0 d. Index hypermetropia. When the refractive index of the media is less than normal, corneal refractive index is -1.37, refractive index of the cortex of lens is -1.3, refractive index of the nucleus of lens -1.40. Clinical types of Type 1 congenital hypermetropia, Type 2 simple or developmental hypermetropia, Type 3 acquired hypermetropia. First we see about congenital hypermetropia of Point 1 congenital hypermetropia is rare. Point 2 it is usually associated with other congenital anomalies of the eyeball like micro-ophthalmos. At second we see about simple or developmental hypermetropia. Point 1 simple or developmental hypermetropia is the most common type. A newborn baby is hypermetropic, but with age the eyeball grows in size and the hypermetropia is gradually diminished. Acquired hypermetropia. Acquired hypermetropia is found in aphakic conditions, commonly following extraction of the lens. This hypermetropia is usually high, about +10.0 d. Effective accommodation on hypermetropia. Total hypermetropia have two types: 1 latent hypermetropia, LH, 2 manifest hypermetropia, MH. Manifest have two types: 1 facultative hypermetropia, FH, 2 absolute hypermetropia, AH. TH equals MH plus LH, MH equals FH plus I. In the above formula, TH is total hypermetropia, LH is latent hypermetropia, Marshall Islands is manifest hypermetropia, FH is facultative hypermetropia, I is absolute hypermetropia. Latent hypermetropia. It is the amount of hypermetropia which is corrected by normal physiological tone of the ciliary muscle. Manifest hypermetropia. The remaining portion which is not correct by the normal physiological tone of the ciliary muscle is called manifest hypermetropia. This manifest hypermetropia is again made of two components. Components 1 facultative hypermetropia, components 2 absolute hypermetropia. Facultative hypermetropia. It is the part of hypermetropia which can be corrected by an additional effort of accommodation or excessive strain of the ciliary muscle. Absolute hypermetropia. It is the part of hypermetropia which cannot be overcome by active exertion of accommodation. Symptoms of hypermetropia. Symptom 1 is headache, Symptom 2 is eye strain, Symptom 3 is distance blurred vision, Symptom 4 is difficulty in doing prolonged close work. Treatment of hypermetropia. Treatment method 1 is concave lenses, treatment method 2 is contact lenses, treatment method 3 is LASIK. Complication of hypermetropia. Complication type 1 is hypermetropia with esophoria to give full correction, complication type 2 hypermetropia with esophoria to give under correction. Thanks for watching our channel. Please share the video and subscribe the channel.